I'm Elizabeth Njovu from Zambia. I'm going to present my topic entitled Shortage of Nursing at St. Dominic's Mission Hospital in Ndola. The shortage of nurses is a problem that is common everywhere in the world. Nurses form the largest number in the healthcare system and play a significant role in providing direct patient care. Considering the importance of the role of nurses in the healthcare system, it is important to investigate how nursing shortage affects the quality of patients' care, nurse job satisfaction, and their work stress. Zambia is not an exception to this scourge. Most hospitals face this challenge of nursing shortage. One such hospital is St. Dominic'S Mission Hospital, located in the outskirts of Ndola. There is a confirmed positive relationship between nurse shortage and workload. There is also a significant positive relationship between workload and the quality of patient care. It can be said that in Zambia, nursing shortage influenced the workload of the employee, finally affecting the quality of patient care. In addition, the study recognized the capability of nurses to manage their emotions as well as emotions of others, which has increased their tolerance to control psychological stress in performing the duty. This study confirms that nurses' emotional intelligence acts as a partial moderating variable for job outcome of nurses. In every healthcare system, nurses are the heart of the care of the patient, and their shortage is very complex. The shortage of nurses has an adverse impact on the healthcare system around the world. The shortage of nurses in many hospitals and their impact, particularly on the compromised quality of care, has become a common phenomenon. This research has been conducted to assess effect of shortage of nurses on the care of the patient and on the few nurses that provide care to the patient at St. Dominic's Mission Hospital. When staff nurses are not adequate, the result is that quality nursing care is compromised and nurse burnout. This research is being conducted to assess effect of shortage of nurses on the care of the patient and on the few nurses that provide care to the patient at St. Dominic's Mission Hospital. When staff nurses are not adequate, the result is that quality nursing care is compromised and nurse burnout and stress is evident. The importance of this research has added to evidence-based research on effects of shortage of nurses on the patient care and the few nurses working. Findings are beneficial to both patients and the human resource planners in planning for adequate nursing professionals, in improving quality nursing care and preventing stress and burnout of nurses. In the research done in March 2004 by the Agency of Healthcare Research and Quality on the impact that nurse shortage has on the patient outcomes, the study shows that hospitals with lower nurse staffing levels and fewer registered nurses tend to have higher rate of poor patient outcomes, nurse burnout, and stress. This research was a reminder to the human resource planners that for the quality patient care, adequate nurses need to be deployed in the hospital and healthcare institutions in order to reduce on nurse burnout and nursing workload. The problem and the solution that the research was able to identify: the shortage of nurses in the health institutions has remained the major challenge and problem in most countries, especially in developing countries, exposing the few nurses that are working to work long hours under very difficult and stressful conditions and are fatigued and have less job satisfaction. Nurse shortage has contributed to the compromised care of patients. The most effective solution in addressing the problem of nursing shortage is through retention and recruitment, which remains the most important ways to achieve a long-term solution to the nursing shortage. Recruitment should be done in a more attractive way to make nursing profession appealing, especially to young people. The work environment for nurses should be redesigned in order to achieve job satisfaction. The other way to reduce the shortage of nurses, and especially at Dominic'S Mission Hospital, is for the hospital administrator through the Ministry of Health to revise the staff establishment, which has remained the same for a long time, even after the growing number of the population accessing services at the hospital. At St. Dominic's Mission Hospital, the administrator through Churches Health Association of Zambia, CHAZ, has taken initiative to train the community volunteers to do the basic nursing care of the patient in order to reduce the workload on the nurses. The community volunteers are able to do bed making, dam dusting, bathing, and feeding of patients. Looking at the background of my research, I was able to recognize that the Zambian government has put in place a national health care system to service its people of about 13 million. The government's commitment to the objective of improving the quality of life of all Zambians has been demonstrated through its efforts to improve health care delivery by reforming the public health sector through the health reforms. The human resource in the Ministry of Health mainly comprise health professionals. Nurses comprise about 75% of all healthcare professionals in the healthcare system in the country. This information is according to General Council of Zambia, General Nursing Council of Zambia 2004. This means that the nurses, who are the majority in the healthcare delivery system, implement most of the healthcare program. The Zambian health system has two categories of nurses, namely registered nurses and the enrolled nurses. The level of training differentiates the two categories. So according to my research, the positions of nurses, there are 6 enrolled nurses and 10 registered nurses. The actual establishment should be 12 registered nurses and 18 enrolled nurses. So we have a shortfall of nurses at the hospital. According to the research, 14 of them. So the study limitation that we found was the participants, I only involved the nurses. So if I had involved everybody, I think I would have gotten a richer kind of information. And because of limited time and a busy schedule during data collection period, some missing responses in the questionnaire could not be followed up. Hence, important information could have been missed. I used the purposeful sampling type of non-probability study, which was useful for me to obtain the information that's from the nurses working at the hospital. And the results that I found, 20 nurses participated, and of the 20, the finding revealed that 100% are aware of the shortage of nurses at the hospital, and 89% feel the impact of the shortage of nurses that has on them. 70% indicated that shortage of nurses compromises the quality of patient care, and 30% indicated that nursing care has caused the poor patient outcome. 55% that participated had knowledge on the nurse-patient ratio for the general medical ward, while 45% did not have. 100% expressed that shortage of staff makes them stressed and work long hours. 90% indicated that 1.35 as the nurse-patient ratio of the medical ward at the hospital, while 10% was not clear of what is the ratio. So in general, I find out that these findings reveal that most participants are aware of the nursing shortage. They have experienced the effect this has on the patient and on them. Concerning the causes of nursing shortage, the participants were able to elaborate at least 3 causes each. Mostly participants talked up almost amongst themselves how the nursing shortage affects their work and the quality of nursing care. And this again is the summary of the effects that the shortage of nurses has on the nurses at St. Dominic's.